Good morning, everyone. Judith Calder and Dr. Zaboulis just gave you a terrific summary of Degos disease. You now know more than 99.99% of the medical community about Degos disease. As the patient having the informal title of longest living survivor of systemic Degos disease, I'd like to take you on a journey of selected episodes in my recent life that give some insight into what it's like to be a patient with this rare and devastating disease. Before I was diagnosed with Degos, I was the picture of health with a full life. My immune system was strong, and it quickly knocked out any cold or infection that I got. I had a busy career as a finance lawyer in New York City. I scuba dived around the world on vacations, and I was looking to meet someone to start a family. I got back from a scuba trip in Mexico, and a few weeks later I noticed these round donut-shaped bumps which were red on the outside and white on the inside. They were itchy for a while, and then it stopped, but the bumps didn't go away. I figured I must have brought back bed bugs. When my doctor confirmed that it wasn't bed bugs, he suggested that I go see a dermatologist. But I didn't give it much thought. They really didn't seem that serious, and I was busy with work. A year later, one of my biggest clients went bankrupt, and all of a sudden I had a lot of free time on my hands. I also started having digestive problems, so I decided, no, maybe it's time I should check things out. For a couple of months, I played stump the Park Avenue doctor. None of the top physicians in New York City could figure out what my skin and digestive issues were. I ended up in the hospital exam room, which was right out of Dr. House. Doctors looking at my skin lesions and throwing out ideas as to what it might be. I mentioned my digestive issues, and one of the doctors mentioned that there are about 2,000 diseases that have symptoms both with skin and with digestive issues. Perhaps out of sheer luck, one of the younger doctors mentioned that, this could be Degos disease. It was so rare that the doctors almost laughed it off, but we decided that we'd test it out and see if maybe it was. It was summer then, and I really wasn't in much of a rush. 2 months later, I ended up in the emergency room. When I woke up from surgery, the doctors confirmed that I actually did have Degos disease. When they left the room, I frantically pulled out my BlackBerry and Googled Degos disease. There wasn't much, 2 articles. They both indicated that it was an exceedingly rare disease with only about 300 reported cases since it was discovered in the 1940s. As I read the articles, 2 words jumped out at me: universally fatal. I read on to see how it was treated, and it seemed more like homeopathic cures than medicine. Herbs, aspirin. This was 2 words jumped out at me: universally fatal. I read on to see how it was treated, and it seemed more like homeopathic cures than medicine. Herbs, aspirin. This was an insidious disease. It took my strongest attribute, my strong immune system, and turned it against myself. I found out that there had been a Degos conference in 2007. Coincidentally, it was right around the time when I had discovered my Degos lesions. This news was disappointing, but it was also a relief. Even if I had discovered my Degos disease immediately and tried to get treatment, there was nothing that really could be done. The one bit of luck that I did have was that Dr. Magro, who you'll hear speak later, was the dermatologist at the hospital who diagnosed my Degos disease. She and others had a theory that a new drug on the market that was meant for an entirely different condition could help Degos patients. I Googled the name and found out that Forbes listed it as the most expensive drug in the world at the time. $450,000 for a 1-year treatment. That amount actually seems tiny in comparison to what it is now. I've seen some of the bills my hospital sends to the insurance company. $110,000 every 2 weeks for my treatment. Now, they don't actually get 110,000. They settle for a discounted amount of 37,000 for fees. Yeah, you can do the math. Yeah, I was a good lawyer making a pretty good income, but not that good. In the beginning, the drug company was willing to offer it to me on a compassionate use basis. As long as the research protocol was able to be established with the hospital. That turned out to be no small feat. 2 months of negotiation and still no progress. My condition worsened to the point where I was in a coma in the ICU and given 12 hours to live. My doctor spent 5 hours with the hospital and with the drug company to try to get them to let me use the drug. It came down to the drug company was afraid that if I died, my family would sue them. Finally, my doctor convinced them that whether I died because I got the drug or because I died because I didn't get the drug, it wouldn't matter. It was a complete Hail Mary pass, and it worked. Overnight, to everyone's astonishment, academic articles were written and patients were saved. Now when I went to the internet, I could read how there were possible cures and treatments, but they were exceedingly expensive. I thought I was out of the woods, but that turned out not to be the case. A couple of years later, my digestive issues resurfaced. I could no longer maintain my weight no matter how much I ate. My friend said, Roger, we officially ate you, right? You can eat cheeseburgers and anything you want, not gain weight. So Dr. Shapiro, who you will hear speak later today, had evidence that another drug meant for pulmonary hypertension patients could also help Degos patients. I saw him, but at first I didn't push too hard. I was still relatively healthy, and I wasn't too keen on the prospect of painful injections. As my condition worsened, I realized I had no choice. My insurance company didn't see it that way. This drug was cheaper, but still expensive, $25,000 a month. They could make an exception for rare diseases, and that didn't seem so unreasonable, except it wasn't. What is rare? New York State defined rare as there being fewer than 220,000 patients. Well, that wasn't a problem. I don't think there were even 20 known patients in the country at the time. But that created its own problem. It was difficult to produce any sort of meaningful study with so few patients. And it didn't really matter because the drug company wasn't interested in doing it anyway. For a year and a half, my doctors fought the insurance company. And during that time, I went from 145 pounds to 125 pounds. I ended up in the hospital before they gave me the drug. My digestion is slowly getting better, but it's still not what it was before that year-and-a-half period. Thanks to the two drugs in combination, my doctor told me I'm pretty stable now, but things don't always stay that way. They cautioned me that drugs that initially work can stop working. They also cautioned me that diseases can change and they can do different things. If you live outside the United States, it doesn't really matter, because unless you're a Russian billionaire or a Saudi prince, you probably won't be able to get either drug, much less both. And the odds aren't much better in the United States. One of the Degos patients who my case helped, was a teenager when he was first diagnosed. He's had his ups and downs, but he survived. He got engaged New Year's Eve, just the way many other people do. Then right after that, the disease reared its ugly head again. His heart started having problems, and he couldn't breathe. Doctors at many venerable institutions refused to treat him because they didn't think he would make it. He has a strong faith, and he did have surgery. He did survive. But to this day, he remains in the ICU on life support. The doctors are skeptical that he'll be able to get off life support, but so far he's slowly weaning off it. It took me over a year and a half on disability before I was strong enough to go back to work. Everyone was supported, but things had changed. I was working just as hard as everyone else, but the office questioned whether I had the stamina to keep up. They cut my salary that was supposed to be a trial period, but that trial period ended up being permanent. I eventually had to move to another firm that didn't know about my condition and would judge me on my actual performance exotic disease that was a huge unknown. In speaking at this conference, the privacy issue came up again. Degos organizations are eager to report this conference for all posterity to help the patients who will inevitably face this disease. Do I really want my disease to be known to anyone, friend or foe, who within a millionth of a second who types in my name in Google? None of us with Degos disease has anything to be ashamed of. People make judgments about people all the time. I'd rather people think of me as a self-absorbed New Yorker than some victim of something universally fatal. For all my ups and downs, the last few years have made it worthwhile. I survived long enough to meet Caroline, the love of my life, who I've always been searching for. We now have a beautiful 8-month-old daughter, Ella, who took her first train trip yesterday to be here to watch her daddy speak. So that brings her journey back to today, this room. The journey could have been much different if it hadn't been for the curiosity, energy, and determination of those in the medical community to pay attention to this little-known disease and its scattered victims. I don't expect drug companies and Richard Sergers to spend billions of dollars and millions of hours trying to find a specific cure for Degos disease the way they might do with Alzheimer's disease. But the victims of rare diseases are no less worthy than those of bigger diseases. It takes institutions like the NIH and medical professionals like you in this room to make sure this fact is not forgotten. Learn more about the disease, share your ideas today, and carry those thoughts into action tomorrow and in the years to come. It's almost a certainty that the next Degos patient is out there discovering their lesions the way I did around the 2007 conference. Wouldn't it be great if they Googled Degos disease and it said, once universally fatal, now routinely treatable? On behalf of all Degos patients now and to come, I thank you for your interest in this conference. Thank you very much.